Well, good morning, everyone. I'm Brady Deaton, Chancellor here at MU, and it's a pleasure for me to be with you with Dean Judith Miller, and certainly welcoming our governor and guests from across the state and the university. I think all of us today know how important healthcare is. We're focused today on the School of Nursing, Sinclair School of Nursing, and the tremendous progress that's been made under the Caring for Missourians legislation that meant so much, and you will see some of those improvements and hear about them later on today. We're dealing at a time when healthcare needs are growing. The progress we've made and our hopes for the future hinge very much on a bipartisan support for this type of educational effort, and we've benefited so much from the coalition that is represented by in the Senate, our Senator Kurt Schaefer, who's with us today, and Mary Still is with us from the House, and certainly the work that Chris Kelly and Steve Hobbs in the legislature provided. And it's that kind of bipartisan support led by a visionary governor who understands these issues and can wield the coalitions that make it possible. And it's for those reasons it's a real honor to be able to introduce to you today a public servant, Governor Jay Nixon, who was first elected to his first term as governor in 2008, a two-time graduate of the University of Missouri, and multiple graduates in his family. Certainly, as you know, previously served as Attorney General and then the State Senate. We're always honored to have him back here on campus. Governor, we welcome you, and we're happy to have you. Thank you.
My two graduates were, my two-time graduate were two separate degrees. As I said, when you have academics of Brady's capacity, it's you always feel a little bit not worthy to give himself. It's great to be here with everyone. I want to especially thank Senator Schaefer, Representative Still, Representative Kelly, also Chancellor Dean Miller, and two members of our state nursing board, which I'll mention in just a little while. Associate Dean Roxanne McDaniel is on our state board of nursing, and Kelly Scott, also from our state board of nursing. We really thank them for their efforts here. I'm glad to be here with these outstanding nursing students. I appreciate everybody giving up a little bit of their time in a busy and pretty day. We'll let these students get back to work very, very quickly. When it comes to the demand for nurses, the facts are very, very clear. Hospitals, nursing homes, and other employers simply can't hire trained and skilled nurses fast enough. As the economy picks up its pace, one thing we know for sure is that employers here in Missouri need more nurses, and that demand is only going to grow in the coming years. And that's good news for the students that are here today. Studying nursing or another health field is a pathway to a secure and rewarding career. And my administration is committed to helping more Missourians enter this critical profession. In 2009, we launched our Caring for Missourians initiative to help more students prepare for careers in healthcare. We provided $40 million to Missouri's public colleges and universities to create hundreds of additional seats in their degree programs for nurses, physicians, pharmacists, dentists, and other professions. At that time, on the campus of the University of Missouri, a commitment was made to graduate an additional 293 students in these professional fields. I am extremely happy today to report that the University of Missouri not only met this commitment, but surpassed it by graduating an additional 58 students on top of its original pledge. Chancellor Deaton, Dean, and others, thank you for your tremendous leadership. That is 20% more. Effective use of resources, and outstanding faculty, demand for excellence, and watching the bottom line all at the same time, a great hallmark of this University of Missouri campus and our system. So I want to congratulate everyone, especially the folks here at the Sinclair School of Nursing who made this accomplishment possible. Now, to continue that momentum and to build on that success, the Missouri State Board of Nursing and I announced a new partnership in 2010 to provide an additional $1 million in grants each year for 3 years to help Missouri's nursing education programs continue to expand their capacity. The Board of Nursing provided the resources for these grants using excess fees collected for state nursing licenses, and the General Assembly approved that program last year. I thank Senator Schaefer and Representative Still for their steadfast support and help in getting that measure through the legislature to put it in our statutes to allow this program to move forward. These grants are designed to help Missouri colleges and universities hire faculty, purchase simulators and other vital equipment, and provide scholarships for nursing students. Colleges and universities are eligible to apply for grants of up to $150,000 a year. Through a competitive application process for these grants, the State Board of Nursing gives final approval for recipients each year. Last year, we awarded 7 grants to Missouri colleges and universities, which created more than 140 additional openings for students to pursue degrees in the healthcare field. This year, we are awarding additional 7 grants that will create 180 more openings for students to pursue a degree in these high-demand fields. Today, I'm pleased to announce that the University of Missouri is one of those recipients. MU Sinclair School of Nursing will receive $150,000 to provide scholarships to 9 doctoral students preparing to be teachers of nursing with special emphasis on underrepresented and disadvantaged students. The school will also expand clinical simulations with emphasis on vulnerable groups, including children and older adults. Now, the 6 other colleges and universities which also received grants this year include Lincoln University in Jefferson City at $124,000, Missouri State University at $144,000, Research College of Nursing in Kansas City, the University of Missouri St. Louis, University of Central Missouri in Warrensburg, and Truman State University in Kirksville. Obviously, this competitive process yielded some great results, and it's great to be here at the University of Missouri leading the way. I applaud the Board of Nursing for stepping forward to continue the success of Caring for Missourians and for helping us educate hundreds of additional students for careers in high-demand professions across our state. This investment is good medicine not only for Missouri's healthcare system, but also for our economy. Now I'd like to invite Dr. Judith Fitzgerald Miller, the Dean of the Sinclair School of Nursing of Missouri, to say a few words. If you would, Dean.
Hello, everyone. We're just so happy to have all of you here. And we're just totally honored to have Governor Nixon with us today. It's a chance for us to show him firsthand how we benefit from the investment he's made in the Caring for Missourians initiative. Thank you as well to Chancellor Deaton and to our members of the state legislature who are here. It's wonderful to have their ongoing support, and we have had their ongoing support. I also wanted to recognize my colleagues, Dr. Bob Churchill, who's the Dean of the School of Medicine, and Dr. Rich Oliver, who's the Dean of Health Professions, who both, their schools both also benefited from the Governor's investment. Thank you as well to our faculty, our staff, and students. I tell you, you are the best. I get choked up. And it's because of you that this school is the great school that it is. So what have we done with Caring for Missourian support? Well, we've increased enrollments, as Governor Nixon said. In our accelerated bachelor's nursing program, we increased by 10 students each year for 3 years for a total of 30 new students. The accelerated nursing program, as you know, is a program for persons who have degrees in other disciplines, and they're able to complete a bachelor's degree in a little bit less than 15 months. So we prepare them and get them into the workforce really fast. We've increased our PhD program by 14 each year over the past 3 years. And we launched our Doctor of Nursing Practice program, which over the past 3 years resulted in 178 new graduate students. The Caring for Missourians money was used to employ faculty needed to teach in these expanded numbers of students. And it was also used to modernize our learning environments. That is, with technology for clinical simulations and for equipment to deliver our graduate programs in an e-learning format. These distance students, as you know, stay in their home communities, and many of them are in rural Missouri, caring for their families and working there while they're studying for their degrees. The good point is that they stay employed in those distance communities with their advanced degrees. The advanced practice nurses will serve Missourians with their advanced skills by providing primary care services. This is a critical need, and in the future this need will increase as 32 million uncovered lives will come into the health system due to our Affordable Care Act. The Caring for Missourians initiative and investment in nursing is well placed. Nurses are needed throughout Missouri, and investing in nursing and other health professions enables a healthy Missouri. Healthy citizens means having a state characterized by quality of life. In addition, our citizens can engage in productive roles. For some, this includes work roles, but for all, it means being honorable citizens who give back to support this state. During a time of recession since 2008, the healthcare industry was the only industry that experienced growth. Our graduates have jobs. 88% of our bachelor's graduates stay in the state of Missouri, taking care of Missourians. A severe shortage of 1 million nurses is predicted by 2020. And Governor Nixon, you have invested in us wisely. You've also made available to us the Nurse Education Incentive Fund, which you have described briefly, and these were competitive proposals. And we've been able to get this funding for 2 years in a row now. It has just been released, so we don't have the check yet. But we have a good plan. As he indicated, this money is used to support the preparation of teachers for nursing, because we recognize that this pipeline, in order to provide more nursing graduates, we need more nursing faculty. Last year across the nation, there were 75,000 qualified nursing applicants denied admission to nursing programs. And right now, there are a little bit less than 2,000 open nursing faculty positions in the country. And those are just from the surveyed respondents, not from all of the schools, from 600 schools who responded to that survey. Anyway, I digress. We are really grateful for the support of our many local legislators for the University of Missouri and their ongoing support, including Senator Kurt Schaefer, Representative Mary Still, Steve Hobbs, and Chris Kelly, who were instrumental with Kurt Schaefer in the initial legislation and getting the Caring for Missourians passed in 2009. We also have benefited from the support of Steve Weber, our local legislative group. So they've been behind the university and this School of Nursing since I've come to town, so I'm very grateful to them. So then, to conclude, for your foresight for nursing and all health professionals, Governor Nixon, we are totally grateful to you.
I'll take questions in just a second if the press has any, but to conclude that, I mean, one of the things that we've been working on in this state for a number of years here is to make sure that when students make take that challenge to get in competitive programs, and when they and their parents and their families invest dollars, that at the end of that is not only, as you said, a stronger citizen, but an economic pathway to economic independence. And this school and this program provides that opportunity, and we appreciate its leadership.